How to clear ear infection quickly with tea tree oil. Ear infections can be caused by everything from wax buildup and food allergies to fetal alcohol syndrome, genetic defects, and internal injuries. Generally, they are caused by viruses, bacteria, and excess fluid that build up in the Eustachian tubes. This leads to symptoms like earache, pressure changes, fever, vomiting, headache, diarrhea, fluid leakage, difficulty sleeping, and an inability to hear properly. Ear infections can affect the outer otitis externa, middle, otitis media, or internal ear, otitis interna, but middle ear infections are most common. Doctor is required to treat chronic ear infection. Ear infections are more common in children than adults, and they can be effectively treated by antibiotics. But because prescription antibiotics kill the good bacteria our bodies actually need along with the bad bacteria that cause infections, they often lead to unwanted side effects. Fortunately, there is a safe, natural, and very effective way to treat small ear infections without prescription antibiotics. It's tea tree oil. Derived from the Australian Melaleuca alterniflora tree, this essential oil has been used for centuries to cure many different ailments. As with over-the-counter and prescription medications, tea tree oil should always be diluted and should only be used as recommended, as excessive can cause negative side effects. Does tea tree oil helps to treat ear infection? Let's take a look at some of the properties that make tea tree oil an effective remedy for ear infection. Tea tree oil is naturally antibacterial, antifungal, and antiviral. It kills the bacteria that cause ear infection. It has anti-inflammatory property that reduces inflammation, pain and irritation. Tea tree oil helps remove dirt, excess fluids, and other impurities that clog the ear and lead to infection. How to use tea tree oil to treat ear infection. Here are some effective methods about how to use tea oil to get rid of the ear infection. 1. Tea tree oil, olive oil, and colloidal silver. Ingredients: 3 drops of tea tree oil, 2 tablespoons of olive oil, 1 teaspoon of colloidal silver, 1 teaspoon of apple cider vinegar. Process: add all ingredients to a pan and place over low heat until warm. Fill a dropper with this solution. Lie on your side with your head on a towel. Drip the solution into one ear. Do not move for 5–10 minutes. Roll over to let the ear drain. Repeat with the other ear. Repeat 3 times a day for 3 days. 2. Tea tree oil and olive oil. In a pan, warm 1/4 cup of olive oil and add 3 drops of tea tree oil. Put the warm solution in a dropper. Tilt head to one side and drip the solution into one ear. Don't move for 3 minutes. Get back to upright position and allow the ear to drain. Dab with a clean cotton ball to clean the oil. Repeat with the other ear. Repeat regularly to treat ear infection. 3. Tea tree oil steam. Inhaling tea tree oil infused steam is effective because the antiseptic properties spread through the sinuses, ears, and respiratory system in the form of vapor, killing all bacteria that might lie within these interrelated systems. It is very effective to treat earache caused by sinus blockage or any respiratory problems. Process: boil 2 cups of water and stir in 3 drops of tea tree oil. Turn off heat. Drape a towel over your head. Lean over the pot and inhale the steam for 5 minutes. Repeat daily. You can also put a few drops tea tree oil in a humidifier. 4. Tea tree oil with warm water. Warm 1/4 cup of water and stir in 3 drops tea tree oil. Put the solution in a dropper. Lie on your side with your head on a towel. Drip the solution into one ear. Don't move for 5 minutes. Turn over and allow the ear to drain. Repeat with the other ear. Repeat 3 times a day for 3 days. 5. Tea tree oil rub. Mix 3 drops tea tree oil with 1 tablespoon of warm water or olive oil. Use fingertips to rub this solution on the back of the ear. Rub gently to get relief from pain. Apply regularly to get rid of ear infection. 6. Tea tree, juniper, and lavender oils. In a small bowl, mix 5 drops each of tea tree, juniper, and lavender oils. Pour this solution into a dropper. Use the dropper to pour 2 drops into one ear. Stuff a cotton ball in the ear so it doesn't drip. Leave it in for 3 minutes. Tilt head to drain. Repeat with the other ear. Repeat daily until you get relief from ear infection. 7. Tea tree oil, apple cider vinegar and olive oil. In a bowl, mix 5 drops of tea tree oil, 1 teaspoon of apple cider vinegar, and 2 tablespoons of olive oil. Heat until it get warm and pour the solution into a dropper. Lie down with your head on a towel. Use the dropper to pour the solution into one ear. Don't move for 5 minutes. Turn over and allow the ear to drain. Repeat with the other ear. Repeat 3 times a day for 3 days. 8. Tea tree, lavender, and olive oil rub. In a bowl, mix 10 drops of tea tree oil, 10 drops of lavender oil, and 1/4 cup of olive oil. Use fingertips to massage this solution gently all around both ears. Repeat daily. 9. Tea tree, neem, and sesame oils. Neem oil kills the bacteria that cause ear infection and soothes the inflammation, while sesame oil neutralizes the other 2 oils to prevent irritation. Process: in a bowl, mix 10 drops of neem oil, 10 drops of tea tree oil, and 2 tablespoons of sesame oil. Pour this solution into a dropper. Lie on your side with your head on a towel. Use the dropper to pour solution into one ear. Don't move for 5 minutes. Turn over and allow the ear to drain. Repeat with the other ear. Follow regularly to treat ear infection. 10. Tea tree oil, garlic, and mullein. Peel and mince 1 garlic clove. Chop 1/2 of fresh mullein leaf. Mix garlic and mullein with 2/3 cup of olive oil. Pour solution into airtight, transparent container and leave in the sun for 10 days. Use a clean, dry cotton cloth to strain the mixture. Stir in 5 drops of tea tree oil. Use a dropper to pour 5 drops into infected ear. Leave in 10 minutes, then drain and repeat process with other ear. Repeat 4 times a day until infection is gone. Tips and precautions for using tea tree oil: always dilute tea tree oil before use, otherwise it may cause irritation, discomfort, and swelling of skin or mucous membranes. Dilute with olive oil, almond oil, jojoba oil, or water, and make sure your solutions contain 3% or less of tea tree oil. If your ear infection lasts more than 48 hours, or if it becomes severely painful and comes with a fever, consult a doctor immediately. If you experience unexpected or severe side effects, stop using tea tree oil and contact a doctor right away. When consumed by mouth undiluted, tea tree oil can cause confusion, unsteadiness, rash, and even coma. Pregnant women should avoid using tea tree oil.